Welcome to Diagnosing the Barriers, a podcast by Physicians for Human Rights Israel. Through our conversations on this podcast, we explore aspects of the right to health and violations of this right, as well as other interrelated rights in the areas under Israeli control between the Jordan River and the Mediterranean Sea. I'm your host, Lee Caspi. Today we're joined by Milena Ansari, Director of PHRI's Occupied Palestinian Territory Department, to discuss a somewhat unspoken and underreported crisis, the financial collapse of the public healthcare system in the West Bank. The few media sources that have touched on this speak of a debt of 2.6 billion Israeli shekels, equal almost to $1 million by the Palestinian Health Ministry to its external suppliers, including pharmaceutical companies. Patients reportedly cannot access essential medications through the public system in the West Bank, and doctors have gone on strike. The sources of this crisis are complex and multifaceted. And Milena, I appreciate you joining us to try and walk us through why this is happening and what can be done to overturn the trend. Thank you for joining us, Milena.
Thank you, Lee. It's really a pleasure to join PHRI's podcast. I'm a usual listener and a fan, so I'm hoping we do this crisis or topic justice and provide our listeners the insight and context they need on this issue.
I hope so, too. Before we jump into the actual crisis, can you give our listeners a little bit of a background about how the Palestinian health system operates, who runs it, how it's structured, how insurance works for Palestinians living in the occupied West Bank, and so forth?
Yeah, this is a really good question to start with. I'll be brief in explaining the hospitals and the pharmacies and the clinics, but I'll give more time on the health insurance because it directly gives context to the issue. So for hospitals, how they operate and how they function, it's similar to any different country or region. You know, we have governmental hospitals that are run and funded and operated by the government. And this also includes clinics, pharmacies, and whatnot. But there is also private hospitals that are, private donations and privately run. And there are charitable hospitals. Like there's no clear, interest in it. It's strictly for the good of the patients and the people. This also includes NGO hospitals. And similar to that note, but on like a smaller scale, is UNRWA clinics as well, which are mainly operated in refugee camps across the West Bank.
Can I ask you to just explain for people who are not familiar with the context who UNRWA is?
Yeah, so the United Nations Relief Works Agency for Refugees is the mandated, based on the United Nations General Assembly mandate, to deal with the question of Palestinian refugees. UNRWA even calls them Palestine refugees, not even Palestinian refugees. They are around 6 million refugees, some in the occupied territory, some across the region, like in Syria, Lebanon, and Jordan. So UNRWA, when I say it deals with Palestinian refugees, I mean it's in a way, it has the mandate to provide health treatment, education, shelter, just the social protection and social rights for Palestinians. And here, the past 3 years, we've seen how Israeli authorities have really hammered down on UNRWA with disinformation, some propaganda, where it most recently it ceased its operations in Israel and the OPT. And this is a really good point to mention that part of the collapse of the Palestinian health system is because a huge sum of Palestinian refugees who are usually taken care of by UNRWA have not been able to get this treatment or adequate services because Israel basically cut the legs and feet of UNRWA from the territory. Yeah. So maybe now I'll go through the health insurance, and we look at it similar again to different countries and areas around the world. The government usually provides health insurance to families. So in the Palestinian context, large segments of the Palestinian society qualify for government health insurance, where many of the services are provided free of charge or with minimal contribution from the insured households. So this insurance basically covers expensive medicines and very complex operations. This is why health insurance is expensive to begin with. And of course, it's subject to availability, wait lists, and capacities of hospitals, pharmacies, and whatnot.
But it doesn't apply automatically to all residents, all Palestinian residents of the West Bank. Like maybe some of our listeners in the UK or Canada or other countries might have an assumption that anybody qualifies. That's not the case here.
So technically, all Palestinians living in the occupied territory qualify for health insurance. They just need to go to the Ministry of Health and apply for it. But for example, you get free health insurance. When I say free, I'll explain it later on. But you get free health insurance if you are in the bracket that's characterized as a poor household. And I'll explain it in an example a bit later on. Even people with disabilities get free insurance for sure. Former prisoners and detainees, they also get insurance. Many unions, like the labor union, the engineers union, lawyers union, they also provide health insurance to like their employees, like the engineers, the lawyers, and whatnot, as well as UNRWA registered refugees. So while I said in the beginning that UNRWA, takes care of the services around refugees, still, because they are Palestinian refugees and the Palestinian Authority's mandate is bigger than UNRWA, so even if refugees take some initial services, because UNRWA just provides primary or maybe secondary health care, but the Palestinian Authority health insurance covers broader than that and bigger than that. And maybe here I'll give the example of how the Palestinian Authority has been, maybe I'll say, failing to try to find the solution, is that since 2025, the Prime Minister Mustafa, one of the main programs that were undergoing major changes because of the restrictions on the PA, the Palestinian Authority, with regards to Israel withholding funding, they tried, they are implementing a new way for health insurance where they add more contributions from the families before reimbursement. So before someone is covered by health insurance, they impose on the families to give like a sum of money, like 100 shekels or 300 shekels, in order to then be reimbursed. And while this in a way helps the government with the budgeting and funding crisis, it adds more challenges or more difficulties to the families. I mean, we're talking about families who many of the times don't have money for transportation to reach a hospital or clinic. So imagine asking them to already pay more money than they can. And while this might, cover a little bit of the burden on the Palestinian Authority, it is directly resulting in less Palestinians utilizing this insurance, not because there's no need, but because they simply cannot afford the direct upfront cost of health insurance. And again, this would reduce government expenditures and insurance payouts, but again, it does not prioritize the patients and their needs and capabilities.
It's interesting how this actually sounds very familiar to a totally separate area of PHRI's work, which is our work with asylum seekers living in Israel, where, not to get into the details too much, but we advocated for a very long time for the introduction for their coverage basically through Israeli health insurance. And while we did get some limited coverage for specific groups, elderly people and minors, the monthly payments that have been added to them are beyond the ability of most of the people in this group who already live in extremely precarious economic conditions. So I guess it's just a strategy of basically, even in a way, if you assume malicious intent to an extent, avoiding having to provide any coverage in the first place, because if people can't afford to pay for the insurance, they're not going to have the insurance. And then when they, God forbid, have cancer or diabetes, they're not entitled to any coverage.
Exactly.
So you touched already a little bit in your introduction on some of the origins of this background. And now I think it would be useful if you can, in the simplest terms possible, lay out what's happening now. Why is there a funding crisis that's sort of exploding before our eyes now? What developments have led to it?
So I've been told my brain functions as a lawyer so much. So the simplest terms and simplest answers sometimes don't come to me. So, but to give you a simple answer, I will quote Amira Haas in her article she wrote in Haaretz in 2019. So years ago. She said basically what Israel is doing to the Palestinian Authority is daylight robbery. And that sums up the whole situation. But for me to explain it, I'm going to go a bit more into the details. So to say, to understand this, clearance revenues, so what Israel is withholding from the Palestinian Authority is clearance revenues. And this refers to taxes collected by Israel on behalf of the Palestinian Authority under different arrangements like the Oslo Accords, the 1949 Paris Protocol. But when I say clearance revenues and taxes, what we mean by this is like custom duties, tariffs, purchase taxes, value-added taxes, VAT, on imports from Israel and the rest of the world. Again, in simpler terms, if you go online and you want to buy something from Shein or AliExpress, you will always see that there is VAT included, like the value-added tax. You always see that there's custom taxes included. So every country around the world, when it imports goods, they have like a certain fees of taxes on these goods. So because Palestine or the occupied Palestinian territory or the Palestinian Authority, they don't have control over any of their external borders, ports or airports, Israel controls these exit and entry crossings or passages. So they take the money on behalf of the Palestinian Authority. And here lies, the issue. So to understand, to emphasize, these are not Israeli funds. It's not that we're saying these money are for Israel and it's a privilege for the Palestinian Authority to take them. No, they are originally and initially Palestinian Authority money that Israeli authorities collect on their behalf because, again, they control borders. So to understand this crisis, it's really important to bring in or understand the mechanism of control that Israel does for Palestinian public revenues. So the dependency of the Palestinian Authority on these custom revenues itself is a product of occupation. Again, Israel controls the territory, the people, the movement, construction, agriculture, and trade. So it systematically constrains the Palestinian Authority's ability to develop independent sources of income, rendering public institutions basically vulnerable to Israeli policies and humanitarian aid as well. So I would take the time to emphasize here, because reading a lot about this issue and hearing different opinions about it, framing the crisis as a financial dispute between Israel and the Palestinian Authority, or framing it as an internal Palestinian Authority financial crisis, it obscures, the more fundamental reality produced by decades of illegal Israeli occupation, economic dependency, and Israeli control over Palestinian revenues that now have reached unprecedented levels since October 2023. And I want to be clear here. The issue of Israel withholding Palestinian Authority revenues is not a new phenomenon. It's not that we, by day and night, woke up to the collapse of the Palestinian health system. No, this was definitely foreseen. Like, I started my answer with quoting Amira Haas in 2019, and now we're in 2026. And I'll be really genuine to the listeners, because it's important to know how Israel justifies these deductions. The simplest answer is they say the Palestinian Authority is funding terrorism. So as a punishment for that, they are deducting from Palestinian money, so it doesn't go to terrorism. But here I'll play the devil's advocate and ask, what is terrorism to the state of Israel? It could be simple as human rights work, Palestinian, for example, human rights organizations calling for sanctions or investigations at the International Criminal Court. For Israel, this is terrorism.
I believe they refer to that as diplomatic terrorism.
Yeah, they call it terrorists in suits.
Yeah.
Even to that point. So as a way, Israeli authorities justify this in a way to explain that the Palestinian Authority is supporting terrorism, so we need to cut its hands and feet.
So what actually changed we know what changed in October 2023, but what changed in Israel's policy on this issue? Because you say that Israel has been developing this policy, stealing basically these Palestinian revenues for many years. What is the big change in terms of the actual financial policy then?
So now in June 2026, a new bill or a draft law was proposed and passed a few readings of its own that added more deductions to the Palestinian Authority revenues. So the explanation of the law says that for every fund the PA, the Palestinian Authority, pays for Palestinian quote-unquote terrorists and their family, instead of 100% deduction by Israel, Israel now can deduct up to 125% shekels. So it's basically saying that in addition to the deductions in the past, now the deductions are to compensate the state of Israel for compensating the victims themselves. So it's adding a double and another layer of deduction that, again, cannot be justified. In criminal law, we know that when a violation happens to a person, they have a right to compensation for physical and psychological damage. But now the state is saying the state is also has the right for compensation. But, as a human rights advocate, I look at human rights more than state rights. And here there's this merge of rightfully individuals' rights, victims' rights, versus the state's right that in a way is complicit and is responsible for, the situation that's happening on the ground.
But since October 2023, Israel has completely frozen the tax revenue.
Yes,
so
completely.
It has actually kind of seized all import taxation for the PA for almost 3 years now.
Exactly.
Which before that wasn't regularly the case, or sometimes happened, or...
Before that, it didn't really also happen. It was in a way, the state of Israel would say, we're deducting this because of this act, we're deducting this, blah, blah, blah. But at the end of the day, nothing reaches the Palestinian Authority in reality. I'd say here, because, in the past, just because we're talking about past and present in a way, many arguments were that the Palestinian Authority provides money to families of prisoners and detainees.
Yeah.
And, as someone who worked at Al-Damir Prisoner Support and Human Rights Organization for 3 years, I at first was wondering, how does that happen? What does it mean? But when you meet the families of prisoners and detainees and you understand the Palestinian context, where usually the man, the father, is the bread owner, who brings in the money. And the majority of Palestinian prisoners and detainees are men. There was a statistics from, I forgot who exactly, but they were saying 1/3 of men in Palestinian families and households are either in detention or have been detained.
Yeah.
And again, this goes to the broad criminalization of basic and fundamental human rights that Israel implements. So imagine a scenario where a family of 3 children, the father is in detention and the mother isn't able to bring in and protect the family. So here it only makes sense that the government supports the families. I'll mention that, in 2012, after the Palestinian Authority obtained a non-member observer state status at the United Nations, the Israeli authorities, as a way of punishing the Palestinian Authority, they deducted more of its funds. And then again, in 2005, following the Palestinian Authority's request to enter the International Criminal Court and for the ICC, the International Criminal Court, to investigate the human rights abuses in Israel and Palestine, again, the Israeli authorities punished the Palestinian Authority and deducted more of its revenues. So what I'm trying to say here basically is these revenues withholding is used first and foremost as a collective punishment against the Palestinian population as a whole. And then clearly it's used in order to eliminate or remove a whole idea of a Palestinian Authority responsible for a state of Palestine and Palestinians. And this is not my own analysis as Melina Ansari. You know, we have seen the most racist, right-wing, I would say, Israeli government nowadays, clearly and explicitly saying this in their own words. Like Minister Smotrich clearly said, I don't have the actual quote. You can look for it. We can share it as well. But in a way, he's saying, I have no interest for the survival of the Palestinian Authority. So we're doing more deductions, more withholding.
Yeah. And he's the minister behind this policy.
Exactly, 100%. And this is how it's happening, you know. It's racist, arbitrary policies that are, at the end of the day, impacting the Palestinians' daily life and access to health.
So I think that's a good lead up to the next question, which is you talk about this policy of collective punishment when the PA does something or something happens in the circumstances on the ground that Israel doesn't like. It uses this tool as one of the many tools of restricting Palestinian daily life and civilian life. How does the situation now look on the ground for a Palestinian patient living somewhere in the West Bank who requires medical treatment, a cancer patient, a pregnant woman, a child with a chronic illness?
Yeah, I'll also start off by re-upping some of the reality on the ground that you mentioned in the introduction. You know, so the Palestinian Ministry of Health faces now debt exceeding 3.6 billion shekels owed to private hospitals and pharmaceutical suppliers. Out of the 590 Ministry of Health service branches, only 447 have ceased functioning. You know, not only, I mean, that's more than 90% of the services. And of the 1,206 medicines that is usually maintained by the Ministry of Health, approximately 250 remain available in limited quantities, and 106 medicines are entirely depleted, with approximately 600 medicines are available only for a few several days. In 2 months ago, in May 2026, the Palestinian Medical Association declared an open-ended strike that is titled "Full Salary in Exchange of Full-Time Work." You know, as someone who reads this title without understanding the human story behind it, would say, how can doctors say, as long as we don't get money, we're not going to work? But the reality is that these doctors, nurses, paramedics, physicians in general, for years and years, and this is not an exaggeration, for at least 5 and 6 years, they have not been getting their full salary. They've either been getting 30% of their salary, working 100% time, or they take, for example, a salary not every month even, like every other month or by the end of the year. So, you know, for doctors, and we spoke to physicians. I spoke to 2 Palestinian doctors in the West Bank. One, a female doctor who has worked as a doctor with the Palestinian Ministry of Health for 20 years. And she said, she reported that, you know, she said, I'm quoting her, I hadn't had my salary for years and years, but the difference now is the West Bank is slowly burning, you know. You have settler violence and military operations across the West Bank in an intensified way. You have Israel blocking all Palestinian laborers from working inside Israel. And we know that many Palestinian laborers have really benefited from good salaries in Israel and working there. So that as a source of income has cut. And again, the military restrictions of movement, the increased checkpoints, movement restrictions, like all of this accumulated on the Palestinian population has made it impossible for anyone to survive without a proper salary.
It sounds like it is a pressure cooker. And I sometimes read some new dramatic thing that happened, and I think I literally don't understand how people are surviving this. Every day there's a new escalation of one kind or another. And we meet this all the time. I'm sure you'll touch on it a bit later in our mobile clinic, where we are now having to invest more in nutritional supplements because we meet patients at our West Bank mobile clinic who cannot afford to eat 2, let alone 3 whole meals a day. And I think what you said about sort of we can't expect a doctor to not keep working. Of course we can. I mean, these people are people too. They have families that depend on them. They have children. They need a reliable source of income. The situation is not new. It's been worsening since October 2023. Since October 2023, you have not had Palestinian day laborers coming into Israel. That source of income is gone. UNRWA has been systematically dismantled since before, but on a very high speed since October 2023. So that's a service layer that's gone. The settler terrorism is totally out of control and worsening. I mean, people need the most basic means of human survival.
Exactly. A pressure cooker is the really on point, accurate description of what it is. And let me just say, like, the consequences are really life-threatening. When you have patients with cancer, kidney dialysis, diabetes, cardiovascular diseases, and other chronic illnesses, they are increasingly unable to access essential treatment to make, their suffering a bit more humane. You have pharmaceutical companies largely stopped supplying medicines because payment can no longer be granted. And as you mentioned, Lee, PHRI witnesses these consequences every week through our mobile clinic that operates through the occupied West Bank, where we are seeing communities that once relied upon public health institutions, they're increasingly getting dependent on humanitarian interventions to access basic medical care. I'll note one of the medical days on the 6th of June 2026. PHRI's mobile clinic visited Kufr al-Ra'i in Jenin government. We treated 765 patients in a single day, including 65 children. This marked one of the busiest medical days in recent years. So so what we're seeing is, more people depending on humanitarian aid and humanitarian interventions over, either their own government supplying this, or the government of the occupying power that is also responsible in ensuring Palestinians as an occupied people get the health access they need.
Or even their own independent ability as individuals who work and earn a living. I mean, many of us pay for services to some extent. And if you take away people's ability to earn an income and you take away international UN supported support mechanisms and you take away their local government support mechanism, what are they really left with?
Exactly. I did want to just emphasize that the burden is also being borne on healthcare workers themselves. I mentioned the female doctor I spoke to that has worked for 20 years, but I also spoke to another emergency physician working in a governmental hospital where he described the impossible choices doctors are being forced to make. And the story or the experience he shared with me, that he recalled an elderly woman who suffered a fall to the head and required a CT scan to rule out any serious head injury. Because the services now for things like a CT scan are limited and reduced only to emergency and life-saving intervention, he was unable to provide the diagnosis and the diagnostic and the care the woman needs. So he was telling me he was constantly thinking about the older woman. He kept checking on her because he wasn't comfortable knowing that he could not provide the care she needed. And here I would just say, because even speaking to journalists, and maybe I'm calling out journalists on this, when we're raising the alarm about like the collapse of the Palestinian healthcare system, and this is a bit of an inhumane question, but they ask me, are people dying? And I say, how can you track if people are dying from them not even being able to reach a hospital or a clinic? So there's no way to even track the casualties behind this. But what I tried to explain is, it's not, this is what we saw in Gaza too. Like, people focused on, are people dying from the Gaza Humanitarian Foundation? Is it death? Like, why do we wait to see a big number of deaths and casualties in order to act? The thing is, behind every medicine shortage, behind every salary disruption and clinic closures, there are healthcare workers and patients struggling to uphold, their professional duties while patients are denied access to basic healthcare. So we're ringing the alarm so patients, like cancer patients, don't have to suffer every day because they have cancer. This is not how, human life should be looked at. We should be, looking at a humane solution for patients instead of, suffering more and more from physically being ill, but also psychologically having no other option to save themselves.
I think it's really important that you put things in those terms, because you're right. We shouldn't be asking ourselves just, is there death here? We should be asking ourselves, is this life? And is this a life that I would be willing to live? I think something has happened in how the world views Palestine and Palestinians, which is just soul-crushing, which is, if it's not an image of something horrific, then it doesn't get a response anymore. But I live here in Tel Aviv, and less than an hour's drive from the West Bank, I have a chronic autoimmune condition that is managed through medication and is monitored through testing, and it makes life totally manageable, and I can prosper in many ways for me. Why would my neighbor not have access to that same technology, which should be available to anyone, at least at the most basic level? Is this life? And what are the prices for putting a population in a situation where they need to be grateful for receiving the most basic means of human survival?
Yeah. Unfortunately, this is life under occupation that restricts basic human dignity and human rights.
Yeah. So my next question was going to be, it's a grave situation, and there's no shortage in our local context of grave situations. This one is a little bit technical, maybe hard for people to wrap their heads around, and it's getting less attention. But is anything being done about this by the international community? Is there any pressure on Israel to release these funds?
So the brutal answer is no, but if even there were actions, they're not enough at this point. When we're talking about billions of shekels in debt, when we're talking about services completely being suspended and patients not getting care, we need urgent, immediate intervention. And I would say it's not enough because we still look at these deductions, like by the Israeli authorities, or the freezing of Palestinian Authority revenues, as like a fiscal problem, like a financial problem. And here, someone I really respect always says, in order to find the proper treatment for an issue or like an illness, you have to have proper diagnosis. So if we're not diagnosing the issue, and this podcast is called Diagnosis the Barriers, so if we're not diagnosing the issue in a proper way, we will not have a medicine, quote unquote, or a treatment that is applicable to it. So it starts by the international community recognizing that the collapse of the Palestinian healthcare services is a public health health emergency requiring urgent action. We should stop looking at it as like a funding crisis and understand that it is part and parcel of Israel's policies of occupation, apartheid, that will always seek to, dehumanize, belittle, strip Palestinians of their rights in order to get whatever their intention is as a state. And I'll leave it to the state of Israel to say their intentions. But we need to, expand support for medicines and essential healthcare services in the West Bank, while emphasizing that, again, humanitarian assistance alone cannot substitute Israel's legal obligations to release the money, but also, stop illegal settlement expansion in the West Bank, remove the movement obstacles, remove the checkpoints. All of this, again, is an accumulation. If we just put a plaster on it, it's not really gonna save lives on the ground. So the international community needs to step up, putting pressure on Israeli authorities to release the money, or at least they need to, support more Palestinian governmental hospitals, support the patients more.
And where in all of this do you see the role for Israeli and Palestinian civil society? What's happening? I mean, it's kind of a new focus area for us at PHRI, although we've been hearing whispers for some time now. Do you know of any initiatives happening?
So we really asked ourselves, like, is this, because PHRI, we do the legal work, filing petitions, fighting things legally in the Israeli judicial system, but we also, do the immediate responses to the needs, like the mobile clinic. We are increasingly in the West Bank, in these mobile or in these medical days to, provide immediate relief to the patients. But on an international level also, we're mobilizing the targeted audience, let me put it that way. Like this podcast, everything starts with spreading awareness. And the first step is understanding the context so you know how to challenge it or fight it. So for us, we're raising the alarm in regards to spreading awareness to the issue, contextualizing it a bit more. And there's a lot of role for human rights organizations based in Israel. One of it is, always speaking up on this issue and putting it in context, but also, connecting the dots. For PHRI, as the head of the occupied Palestinian territory, we have a petition on the medical corridor that also talks about, the need to allow Palestinian patients in Gaza to evacuate, to seek treatment inside the West Bank, including East Jerusalem, for the continuity of the Palestinian healthcare system, for the continuity of treatment in general. And this is where we connect the dots, When we say the Palestinian healthcare system in the West Bank is collapsing, but there are patients also in Gaza who need treatment, this is when we tell the international community, you keep talking about a two-state solution, a peace process. Recently, X number of states recognize Palestine as a state. So now is the time where you put your money where your words are, or whatever that phrase is that, connect the dots, allow Palestinians in Gaza to seek treatment in the West Bank, and at the same time support Palestinian hospitals and services in the West Bank. This is where, we need to be pushing together and out loud.
Very well put. As you mentioned, and I do want to say a few words for our listeners who don't know it, PHRI operates a mobile clinic in the West Bank. We actually used to also have clinic days in Gaza before October 2023, but have been barred from doing so for nearly 3 years now. But we do still operate a clinic that takes volunteer doctors and nurses from Israel, both Jewish and Palestinian, to 2 different Palestinian communities in the West Bank every week to provide incredibly needed medical care and increasingly medication. People who are diagnosed and know what their issue is and are just coming because they have no other way of receiving the chronic medication they need. Even things as simple as high blood pressure medication, medicine that they used to be able to receive at their local pharmacies or through their local general practitioner. Our budget is limited, like all nonprofit actors, and if you'd like to support us so we can continue doing everything we can to meet the needs on the ground, now would be a great moment to do so. As we finish this conversation, Melina, is there anything you'd like to add for our listeners?
Yeah, maybe just one thing on the mobile clinic, because just to clarify, I'm new also to PHRI. I started in March. So when
you don't feel new anymore.
I know, not anymore, for sure. But why I mention this, because first time I went to PHRI's mobile clinic was last month, where I saw the work of PHRI. And again, as much as I knew what we do, I never understood how much impact and it matters to the people we serve, the Palestinians that we serve. I was sitting with doctors helping translate Arabic between English and whatnot. And, the patients, they want simple needs. We're not, we talk about cancer patients, diabetes and whatnot, but many of patients want simple, like cream for infections and whatnot. And I told myself, as a Jerusalemite Palestinian, I go to a pharmacy, and if I'm Clalit, for example, I just give them my card and get these medicines or medications for free. And I kept wondering, imagine, for Palestinians, it depends on where you were born to see the amount of rights that you get or privileges that you get. And to me, that speaks volumes. But again, so that was the personal identity crisis of it all. But seeing the patients wanting to be heard, wanting to be listened to, and getting medicines and treatment that they dream about, was fulfilling in a way that we should be doing more. Something as simple as this, we can do more. And here comes, the support of the listeners. What can you do as a listener? If you don't know how to support directly, if you don't want to, attend a protest, a peaceful protest, you should be able to support, organizations like PHRI that you see the impact on the same day. I'm used to, working in big organizations where you see the impact maybe after 5 years, 6 years, because it's international law. But this is important humanitarian work that needs to expand and needs to continue with the support of the listeners, our partners and allies in all of this.
On that note, I want to say thank you very much for joining. I have to say that you helped clarify things for me, because I didn't totally understand how the revenue system works. So I hope that you clarified some things for our listeners. For those of you who listened all the way to the end, thank you very much for listening. If you haven't already done so, please like or subscribe to our podcast. If you have any questions or thoughts that you'd like to share with us, I welcome you to email me at leec, that's LEEC, @phr.org.il. And thank you very much.